morning, everyone. I'm really excited to be here with you. Coming from a very broad policy perspective, as you hear in a few minutes, it's very reassuring to see the work that you're doing with families and schools and parents to create better opportunities for children. So I admire very much that work, and I'm sure I will learn a lot during these 3 days. What I will bring to this discussion is around your interests and how do you make connections with the broader environment, and how do you link up with the big challenges of climate change and pollution, and where does the transformation, and I added that to the title of my talk, because I think really what we need is transformations in this broader physical environment and urban environment in ways that can allow early child development. So although we're starting from different entry points, I think the purpose of this conversation is to bring some elements. So where do we find the middle ground? And I hope I will bring to you some of the excitement that exists in creating those transformations, especially in cities, but around the range of public policies that end up or not in clean air or in dirty air, for example. So I'll start and I'll dwell quite a bit on air pollution, and I'll explain immediately why. Partly because it's a huge global problem, partly because we didn't know that it was such a big global problem until a few years ago when we managed to get the right data and get the right analysis. So we're still getting to grips in providing that response to air pollution and health. It is a very big health issue. But also because air pollution sources have a lot to do with the climate change sources. So we're talking of the same kinds with two different impacts of the same kind of processes. And I also intuitively am seeing how much of that has to do with families and young children and how much that brings into their health and early development. So I'll start with saying that air pollution, it is an invisible killer, or you can see it in some places, but not often. And it is responsible for, and I think you'll be surprised, I was, when we first got this analysis going in WHO a few years ago, it was end of 2014, when the first results came out, that you have a third of heart disease, of strokes, and of lung cancer, which are due to air pollution. Now, that's amazing. That's enormous. Because what you have, and this, I'm bringing you some blood. I mean, as a good doctor, I like to see pieces of body, that kind of thing. I think it sort of brings home the concept. The lung on the left, these are lungs from São Paulo, a big city in South America, in Brazil. The lung of the left has used a lot of tobacco. And the lung on the right has used no tobacco, but has lived in São Paulo. So this is a pathologist who has been following people who are exposed to air pollution. And there's a lot of work that this guy has done. And the interesting thing is that they have the same kind of pathological imprint. It's soot in the lung. So the difference is that with tobacco, you're smelling or you're breathing it into your lung directly. And in air pollution, it's a bit more diluted. But you could also say that the air pollution one is the one that children and pregnant mothers are breathing, even though they're not smoking, and even though there's not environmental tobacco smoke in the house. So there's very little control that these people can have. These are two lungs. The right one is from a non-smoker in Delhi, and the left one is a normal lung. So you see what a normal lung looks like. It's pink, reddish. And what an environmental pollution lung looks like if you're living in Delhi. And this is from a surgeon in Delhi. That's a non-smoker. So lots of soot in the lung. Same thing, this is an adolescent. So even at early age, you can see lots of those soot impregnations or intrusions in the lung. So the curious thing now, the curious comparison with tobacco. Tobacco, as air pollution, each one causes 7 million deaths a year worldwide. So it's the same number of deaths. And both of them, tobacco and air pollution, have systemic impacts. The air pollutants are very tiny particles that go into your lungs and into your bloodstream. So it causes heart disease, stroke. Now we know there's evidence on dementia, and there's evidence now, recent, on development issues or cognition in children. So there's also reproductive impacts on both. And in terms of children, there's low birth weight, there's a number of impacts. And the reason why children are of special concern is that they're not small adults. They have a very different physiological build. So they do breed a lot. They're much more exposed to environmental factors. They breed much more than, as the next slide, 3 times more than an adult. So they consume more dust and soil, more water, more dietary fat, more fruits and vegetables. So overall, they are, on a kilo per kilo basis, they are much more exposed to the environmental factors. So also because of that reason, the attributable mortality due to air pollution in young children, that's under the age of 5, is much bigger than in adults. Proportionally, they die much more than adults do. This is a picture of how much, this is 500,000 deaths a year, roughly, those are the estimates, under the age of 5 are due to air pollution. And one important thing is the main cause of death in this age group is pneumonia. And we all were worried about vaccination, and correctly so, with pneumococcus and all the rest of it. But the real cause and the biggest cause of pneumonia in children in this age is air pollution. It's actually indoor air pollution. And we'll come back to that. So in addition, you also increase the rate of development of asthma in children. And you know that this is air pollution according to age. So it starts affecting the body in pregnancy, still in the womb. And then it causes in children asthma, slower lung development, developmental problems, intellectual and cognitive problems, wheezing, coughs, and creates the basis for atherosclerosis later in life. And the beautiful thing is that this is lung development. And what it shows in these 2 slides is that if the kids are living in more polluted areas, or if the pollution is increasing, this is American data, this is California, then the lungs get lower and lower function. But if you improve the air, if the kids move to a different area, of the air improves in the area where they live, then the lung starts developing again. So it's not completely hopeless as long as you act early enough and give children these opportunities. So the real question is, and that's where the transformation that I think we're talking about here is, where does it all come from, all this pollution? And there's all these sources, and I'll start with indoor air pollution, because this is so important for children at young age, because they're more exposed, they're in the home with the mothers as well. So indoor air pollution caused by dirty fuels or inefficient technologies for cooking, heating, and lighting are the big cause. And I'll put a finger in a few things that are perhaps not commonly known. Kerosene lamps are a huge source of soot in air pollution. It's a very big issue. And perhaps, and there's a very easy solution. There's solar lamps that work very well, that are cheap, and are available everywhere. The guy in the middle is a rich guy somewhere in either the Chamonix Valley or in Montana, but he doesn't know, and he has a child next to him, that also that so-called sophisticated use of wood in fireplaces is a good source of air pollution, indoors and outdoors. So I think that's also a misconception. And the lady on the right is cooking with wood, and of course that's with a kid on her side. Not only those indoor air pollutants or those fuel sources cause air pollution, but they also are a cause of burns, of intoxications. In the case of kerosene, many kids drink and is one of the largest causes of intoxication. And also is a cause of children having to spend their time, especially girls, collecting wood. And on average, we assess that in I think 11 countries. And what we found is that you have girls spending on average 15 hours a week collecting wood. I mean, boys also do that, but it's a less number of hours. And so I think that means lack of opportunity for education, and for women for the productive use of their time, because they also spend much more time cooking. So I think that I wanted to put first because it's such a big issue for children at this age. In addition, another issue that I'm sure in the region is important, I don't know in Vietnam exactly, but is the burning of waste. You certainly have the burning of agricultural waste in the Asian brown cloud that comes across boundaries of countries here, but the burning of waste in the backyard and the fact that people are very closely associated to it, very near, is a very big source and very easy to avoid as well. I mean, there's waste management techniques and there's businesses around waste management which are possible. The third cause is transportation. And it wouldn't be a surprise to you, all the pictures which are showing here. I think one is from Delhi, the right one is from Hanoi. And the fact is, although these people are wearing some surgical masks don't work. I'm sorry. I mean, it would be wonderful if they did. They don't. So the personal protection is very limited. Maybe if you isolate all the windows of your house and you have lots of machines filtering the air, perhaps. But even that, the evidence is not very clear. So transportation solutions for that kind of confusion that you see on the right, I think is one important thing. And one big elephant in the room is coal-fired power plants. It's not only air pollution, it's also the biggest source of mercury contamination in people. Mercury comes, and mercury is a very toxic heavy metal, comes from coal-fired power plants. And in cities, in the area, this is Hong Kong, because Hong Kong has been taking leadership in port areas air pollution. They have done some very good thinking. California has also done, Los Angeles and some Chinese ports are doing that. But one of these big ships can pollute more than 25,000 in a day, 25,000 diesel vehicles. So that's a lot because they use very dirty fuel, lots of sulfur. So I think if you're in a port area, you have to think of that if you want to reduce the pollution. Brick kilns is important in certain parts of the region, Nepal, India, and some other countries. And the fact is, and that's part of the reason why we're focusing, I'm describing first pollution, and then briefly some other environmental risks, is that it affects most people, 90% of people in the world. The other risks that I will mention, although I won't dwell so much because they affect some specific groups of the population, is, for example, artisanal mining. And there's a lot of heavy metals in artisanal mining. Children and families engage in that. and they're acutely exposed, and there's major problems for cognition, memory, motor skills. I mean, this is major in terms of the kinds of heavy metals that you have there. The second big cause is lead in paint, and I don't know what's the status of the region on that. But this is one of the preventable, easily preventable sources of lead exposure. And they, children face paints, toy paint, paint of the walls. I mean, that's very important. It's easily done at the government level in terms of requiring some regulation and legislation on that. And the third cause that I would mention is also occupational, is electronic waste. Many countries do a lot of recycling. At one point, I worked a bit with recycling NGOs, and they were not aware of the risks from heavy metal exposure. And this, again, is done by families and involves young children and sometimes pregnant mothers. So, big issue. And I won't dwell on those today because they are from specifically population groups, but I think they're very important. I just wanted to mark the space. Air pollution has the same sources of climate change as I mentioned. And we've talked, and UNICEF has mentioned the fact that there's increasing temperatures, extreme weather events, forest fires, droughts, sea level rise, and there's a lot of emergencies which are increasing due to climate change, and we expect to see more of those. So that's not good news. What I want to focus on is more on what are the solutions for that. I know that UNFCCC, the UN Convention on Climate Change, should be doing that job. I don't think we all see that they're not yet there. And the job is very big. So I think the discussion here today is also see how is it that we engage productively in a climate change mitigation agenda. And how is it that actions to mitigate climate change and to reduce air pollution can improve children's health in your city, in your school, in your neighborhood. So it's climate change you can see as an outside or as an externality or something which will be coming in addition to what you're doing for protection of air pollution in your children. So for me, those are the two differences. Climate change is dramatic, is catastrophic, is long-term, and is global. Everybody will be affected. If you pollute, if you don't pollute, you may be living in New Zealand, right? Some rich people are moving to New Zealand because they think they'll be protected in the environment. I love New Zealand, but they want to be protected. I mean, bad news. It's global, it is for everyone. Air pollution is different from the point of view that is local. Who pollutes suffers from the pollution, their neighbors suffer, their children suffer, the impacts are local, and they are short-term and long-term. So if you do something to reduce air pollution, it will improve climate change as well, but you can measure immediately or very shortly after what happened to pollution and what happened to people's health. So there's a lot on in terms of looking attentively to this indicator, because it's also an indicator for climate change gases. But the question to you, I'm sure, is what are the synergies with early child development? And I think some of them have been raised by the introductions this morning. Cities, urbanism, urban development, urban reconstruction and transformation are potentially a source of a lot of good stuff. There's a lot happening in cities which you can see as difficult, as challenging, but you can also see it as creating enormous opportunities for early child development and for the environment, including climate change. And I'll just list some. I'll go a bit I'll describe a bit some of those aspects. But availability of green areas and access to nature, housing, transport, land use, waste management, those things create proximal risks to health, like traffic injuries or air pollution or noise, which is a big thing for early child development and cognition, or physical activity or possibilities of social interaction, which are more proximal risk factors. And they are the ones that make the connection with early child development, with climate change, and with also prevention of heart disease, strokes, asthma attacks, respiratory diseases. So there's a lot to be said about working with cities and getting the package of policies that can clean up the air. And I'll give some examples very briefly. This is rapid bus transit systems. This is the place where they started in the 1990s in Curitiba in Brazil. But it's sort of been multiplied for many other cities in Latin America. It's a great solution, rapid bus transit systems, BRTs. This is solutions for transportation. You may think that autonomous cars or electric cars will solve your issue. Well, a bit, but in fact, you have a comparison between what happens if you have autonomous cars and electric cars or normal cars. They transport the same number of people. So you're not really resolving congestion, you're not really resolving traffic injuries, you're still stopping people from walking and using the space, and you're still having noise. So hello, I mean, there's something there which says, well, it may be part of a solution, but maybe the solution is more on electric buses or electric two-wheelers, which I put on the right. So I think there's a lot of knowledge on that you can tap in, and that discussions, I'm not inventing this. I mean, there's loads of people who have been working on this and analyzing, and there's good experience that can be brought into play. So sustainable transport, if you're thinking health and child development, is really about public transport of high quality, cycling in space, safe space for cycling and walking. And that's because it reduces injuries, reduces noise, enables physical activity, is more equitable, and eases movement of older people as well as young people. So there's a lot in that package of what's sustainable transport, sustainable and healthy and transport that supports child development. Basically, you have to create the space, right? I'm bringing this. This is not the Netherlands. I'm sorry. I think there's some Dutch people in the audience, but this is Denmark, right, which is equally good in terms of as the Netherlands in terms of creating space for cyclists and for pedestrians. I mean, it's amazing. 40% of the people in Copenhagen go to work on a bicycle, and that's clean and that's good for their heart disease and. The other area which we know quite a lot about is access to green and to nature, and especially on mental health impacts or benefits and early child development or child development benefits. In addition to protecting from climate change, some trees absorb pollutants. They create barriers, physical barriers to pollutants. But they also, you know, that cities are warmer than the nearby spaces. It's called the heat island impact, which is something which is cities are worse off than the countryside, and especially in light of climate change, this is a problem. Now, if you have green areas, that improves your heat island impact. And in terms of mental health, there's an increasing amount of evidence from urbanists and health people demonstrating how is that these spaces also facilitate social interaction that are important for mental health. Home energy we've discussed, and I'll spend 1 second focusing on why is it that we really need very clean household energy solutions. If you look at that, I don't know if you have, that curve there, you show that a lot of the benefits from reductions in air pollution are at the lower. You really have to get very clean air to get the benefits. So the myth, and I'm going to stress that, the myth about an improved cook stove that is done locally and, you know, it seems cool, Maybe cool and good for deforestation, maybe good for energy efficiency. But if you want health, then you really have to have some very clean air inside the house. And you're talking gas or clean fuels or very, very efficient technologies, solutions. So I think that has to be tested, and I'll warn you, because this is the biggest risk for air pollution in early childhood, and I think that's important. And that's done in WHO to dismiss that myth, and there's some guidelines with lots of science behind it that says don't use kerosene, don't use coal ever, in a household. No technology in a home, the small technologies cannot be efficient enough to use coal or kerosene. Use only, there's a way of assessing the emissions. In the meantime, use alcohol, bioethanol, or gas, other clean solutions. In terms of housing, it's another area which is subject to regulation, government regulation, normally municipal regulation. There's a lot to be done. There's a new guidance from WHO on healthy housing, still waiting to be translated into, maybe a labeling system, maybe a model legislation. It's been finished recently. There's a lot of risks to do with housing, and there's a long list, and I won't go through that. But I think it's one of the mechanisms that you can engage easily to create this transformation in the physical environment of children. The child themselves or the family can hardly do something to change completely their home environment. Now, if you're producing regulation in a city, you can, because you can require, like there's, for example, environmentalists do LEED labels for, very energy efficient buildings. So why can't we have a label which is for healthy children? What's a home for healthy children? And that could be incorporated to legislation. This is just some of the evidence showing that if you do improve insulation and ventilation, you can reduce diseases, you can reduce healthcare costs. These are examples from New Zealand. As you see, I love New Zealand. These are examples from South Africa, that you can also work in slums or in very poor areas. There's interventions to improve energy efficiency and provide access to clean energy in slums. And so that's the housing bit. Now I'll go to the school bit, which is your territory, right? And there are some studies. This is a recent study which I found very interesting that looked at ultrafine particles from air pollution in different schools and in the kids' home and in the school that they were. This is in Barcelona, but there's some other European countries. And they just published a summary of their findings. And basically what you have is that these ultrafine particles are associated with ADHD, with memory problems, and with cognition issues in these kids. And the schools which were, that you compare in different schools, so the schools which are further away from traffic, these were specific traffic-related air pollution. So the further away the schools and the homes were from traffic, the better the kids perform in terms of cognition and in terms of ADHD symptoms, etc. So I think it provides one of the models, that perhaps one of the closest models for what you're working with, that maybe one could be thinking of low emission zones, not in the center of London, or in a big city, but around schools. And that would include the way to school, the homes, and the schools themselves. And I think I leave that as an idea for the group, because I think this evidence is pretty powerful. Also, green areas around the school reduce the exposure to pollution, which is another intervention. Kids, for example, parents not being allowed to take their kids to the door of the school in a car also improved, because if you create a distance between the vehicles, it is better even if the kids go to school walking in a pedibus or something like that. Solutions these are being adopted in the region to move away from dirty coal power plants. I couldn't speak more about it because it's really a very important exposure. And then you can do things in the health sector. I mean, health sector, and we've been working that because I was working in WHO. But, the education sector, I'm sure, and I was talking with somebody that you are doing that, in terms of the schools could have, clean power, could have good waste management, could have encourage access to sustainable transport to the kids and walking, etc. So there's a parallel between what we've been working with the health sector, medical technologies, how is it they can be working on direct current so they can work with solar. So overall, and I won't go into this because I think it's too much detail, but there's a lot of experience in what are the mechanisms that we can use to integrate thinking and to create public action. I'll go more into the examples because I think it's probably more operational. So the question is, if I'm talking all these systems, all these sectors, there's lots of stakeholders, lots of economic interest. Now, am I bringing too much complexity? What's this guy talking here? So we want to, address the whole of climate change agenda, the whole of the air pollution agenda, if we're just working with kids and early age. Now, I don't think you have an option. I'm sorry for that. Because if you don't engage in those kinds of transformations, then I don't think you create the kinds of environments that allow children to thrive in terms of the physical environment. I mean, you've been focusing on the social environment, and you've been doing great work. But the physical environment is still out there creating these big challenges. So, and the risk is if you don't do that, you may, end up not finding the reasons why, your strategies are perhaps not working. And here's just to pay a tribute. I know the Urban 95 is here, so they will speak better than myself about their work. But I really admire that work because they take the perspective of a child who's, 95 centimeters high. And what is it that you would change in your city if you were that child? So I think that's a beautiful example of the way that we should be thinking in terms of creating the environments. A child under age 5 or 3 cannot, of course, make decisions. Although I should mention one mayor, the Mayor Tirana in Albania, who I've seen them doing enormous. I suggest you invite him to one of the discussions. He does an amazing amount of stuff, engaging children in occupying public spaces, in creating motivation for cities to change. It's about placemaking, but his work is in terms of getting children engaged into that. This is Paris, because I know Vietnam has had some connections with France in the past. And the picture in the left this used to be a highway on the sides of the river, on the main river, the Seine. And now they transformed. I mean, this is a tribute to the mayor of Paris, who had a lot of flack from the car industry and from the, she's done a great work, and I think. And the fact that now you have these spaces for pedestrians, for cyclists, for people to meet, etc., I think is just shows that it can work. And you have the use of cars has decreased in the Paris region over the last 8 years, and the use of public transport has increased. So they have the alternatives, right? You have the public transport of high quality in Paris, so you can do that. But I mean, it's just to say that these strategies can pay off, and they do. So I'll start with my prescription because I'm a doctor and I cannot resist the temptation of saying, you should be doing this. But these are some suggestions for the how. We've talked about what one could be doing to improve air pollution, climate change, and early child development. How do you go about it? Now, that's the million-dollar question, right? So I think the first and the overarching thing is how do you create a vision that is shared by different partners especially in a city, which I think is... And creating that vision, I think, is essential, because as long as you're providing policies from above, some of them, like regulation and housing, can work, but you still can have the housing and businesses, etc., not being completely happy or not complying. So I think building on the grassroots is essential. So one thing that you can find easy with some scientists, borrow from the university some environment department, you can find where are your main sources of pollution. It's a great tool. There's some chemical analysis. It's not very complicated. There's some emission inventories. And for example, when Mayor Bloomberg in the past has done this to New York, he found that the pollution in New York was largely due to 2% of the buildings which were using dirty fuels for their heating and cooling. Now, he then created some targeted action to those buildings, and the pollution improved. So knowing where are the sources of your pollution is a very good help, and is not difficult, and is pretty feasible in terms of technology and costs. You can also borrow some expertise from the health experts and say, well, if we're thinking of doing policy A or B or C, or some of the ones that I was showing here, what do you gain for health? How much do you save in terms of disease, in terms of use of health services? And health people have this technique which is called health impact assessment, which is a relative of social impact assessments and environment impact assessments, but it focuses on health. And so this is good stuff. Again, it doesn't take an enormous amount of work, and there's people who know how to do it. So you're borrowing science, translation from science to policy from people who are experts. So you can include a narrative in your conversation in the city, which has to do with what would happen if in the health impact. And this is just an example for São Paulo. If São Paulo was the same as Los Angeles, then what would happen? Over the line is getting worse in terms of injuries, air pollution, and physical inactivity. Below the line is better. So if São Paulo was the last line, the better option, if São Paulo was very concentrated, like the center of São Paulo, where people live near the jobs, etc., they need less. So this is just an example of a scenario analysis. This tool is a software, can be used by any person who's sort of statistically minded, and is open source, is available at the WHO website, so it's not difficult to do that. So scenario thinking is good for the conversation. No? And if you're using some basis, which is science, I mean, so much the better. Once you have some science, I think you really have to listen and to open your ears about what are your target populations really worried about and concerned about and enraged about. Because if you don't touch their souls and their spirit and the way the things that they really feel are important for them and for what they're doing, then you're a long way from getting a transformation, getting a change. So and there's social scientists, there's anthropologists, there's people who think in those terms, who know about those issues. So do engage them. Ask for that kind of help, because that's very important to get the kinds of stakeholder engagement that you're talking about when you're working with other sectors. Listening is a very important part of that process. And there's people who have techniques for listening. I've done some work in the past on perceptions of risk, and it was fascinating to find. I mean, the main finding was this: if you don't have the mechanisms to listen, how can you communicate? Then you be pontificating about what should be done, rather than framing your messages around what are people really worried about and interested in. So I think there's great value in investing in that kind of understanding. This, if you don't listen, I'm sorry for France again. This is the Gilets jaunes, for somebody who knows European politics. The presidency has decided to eliminate the subsidies or to reduce the subsidies to fossil fuels that happen in Indonesia and many countries. And then people revolt. Why? Because they haven't thought through that there are some people who are very dependent on these fossil fuels or that price and don't have an alternative. So thinking through where people are at and giving the options. So this is a major manifestation. It's been going on for months, and it hasn't got signs yet of being reduced. But I think, well, of course, the government withdrew the measure, but that's important to think about that. Another help is actually citizen science and people getting hold of science and technology. And the example here is portable air pollution monitors. Are they good? Are they precise? No, they're not precise. They don't substitute the proper monitoring. But if they are compared to proper monitors on a regular basis, then you can get some better understanding, especially when you're in terms of moving forward to see if things are changing or not, if there is an intervention. And this is an example in Nepal. I know there's people from Nepal. You know this. This comes every day in the newspaper, and where is the pollution? This is created by civil society, probably because the government was hesitating to free the evidence on air pollution. And this is a lesson for many countries. I mean, many governments were reluctant to disseminate the information on air pollution because they thought it was, I mean, some still are. But the fact is that people can now get hold of this. There's satellite information that we use in WHO, for example, to estimate air pollution. So there's many other sources which are not in control of governments. So I think governments should be astute and really engage with those rather than avoiding, because it's unavoidable. Air pollution is in the public control. And this is a good example of citizen science. This is some manifestations in Kathmandu again, but it's been used in many places. And some schools, for example, could take that up. I don't know how much they are. I'm working with physician movements and people who are using this in terms of creating the awareness on the health sector. But schools could be equally a place for that. Once you've done your homework, I think there's good value in looking at other people's examples. I'm not saying that you're going to copy everything, because you have to really make sense of the international experience and other people's experience in your context. But having engaged with people and understand what they're concerned about, it's useful to look at what's been done. And that's great. There's lots of information you have international agencies who are working with you. There's UNICEF, there's UNESCO, there's WHO, there's ILO. So they also help to broker some of the information and facilitate awareness. So I think there's good value on that. Sorry, it didn't appear so I just brought some examples. Low emission zones, for example, in London. They tried it out. Initially, it didn't work so well, and now it's working very well. So they have that knowledge already there. Use it. No motorized transport in Chennai. Pedestrianization in Istanbul. So those things give you a sense of how is it that they've done it. So, I spoke before about rapid bus transit system in Latin America. One of the lessons was if you don't involve the drivers of small buses, I don't know what was the name here, mini informal transportation, collective transportation. If you don't engage them in the new system, they will fight against it, naturally, because they lose their jobs. Same thing with populations who live nearby the rapid bus transit system areas. So you have to engage them and give them jobs, or engage them in the process of preparation, etc. If not, it's not a winning situation. It cannot come from the top. It has to come from all sides. The top has to be illuminated and willing, but the bottom has to be engaged and participating. So creating this public debate, I think, is one of the essential bits. And one of the debates, or I think what easy debate is, what city do we want? Because the city is shared by everyone, and public space is shared by everyone. So it's a common space to come together and to agree or disagree and come to terms with some of the changes and transformations which are necessary. And especially, I think, there's groups of urbanists who are working around children's issues, and I'm very encouraged to see some of the international work which is ongoing about creating placemaking for children in urban areas. And beautiful stuff on sort of access to nature, kids being able to spend time in trees, dealing with water, with earth, planting, and not only concern with education. There's a cause of stress is to to fill children with their time, with education, and more this, and more schooling for this, and more languages, and more in piano, and whatever. I mean, we all love those things, but, balance is important. And access to nature is very important for early child development. And you can build that into your city as part of the creating opportunities. Because if they don't have the opportunities, they won't be able to move there. So you are used to systems thinking, right? So because you have, I'm just painting a perspective. You have all the sectors, and not only you work in those sectors to reduce air pollution or to reduce climate pollutants, but you have a number of other impacts which you are willing to embrace, and really they're part of the justification for you taking action. Like women and girls' time for education and productive uses were household energy interventions, or traffic congestion reduction and less accidents for transportation interventions. And that's the model that you use in general, from what I could see in your literature on the right. And this is the model that one uses in air quality management. So the question is, getting those systemic understanding and looking at the sources of the issues that we're concerned with, and rather than going in a vertical way in one intervention at a time. I'll give the example of the engagement of the health sector. I think you have done engagement on the education sector, so I won't dwell with that. But the health impact assessment, the economic analysis, making the point, making use of the tools that the sectors have. And overall, this is about creating partnerships. And that includes, and I mentioned this already, with social science institution. Because if you're coming, especially myself, who mix most of the time with people from climate or from air pollution, they are mostly natural scientists, and they love, it's very Cartesian and everything is logical, and in fact the world is not that. And I think that comment is more, I think, for people in those sectors rather than for you. And as I said, the people who have are able to broker that knowledge more easily, like the United Nations. And use the professionals to convey your message and also to listen and to understand and adapt the solutions. And I'm used to training physicians to advise on air pollution reduction and protection measures to patients and communities, but also to listen to the communities about what are the constraints that they have and how easily they could take up or not some changes. The sixth, and I'm also in the last recommendation, is look at businesses. There are business solutions. There's entrepreneurship around the needs for a clean environment and sustainable urban transport. There's some beautiful work in Colombia, and I saw there's somebody from Colombia here, in Medellin, around using impact hubs and mentoring of adolescents around the issue. So you engage with adolescents on the issue of physical activity and socializing and learning, but you also make an engagement, a link with the entrepreneurship and some mentoring, etc. So I think, understand, it's not that you're going to do everything that the business wants, but that's part of the solutions. It's important. Here are some examples. It's just bulk buying in terms of electric buses or e-bikes as one of the examples. And the last one, I heard, I think 4 times or 5 times, SDG 4.2 mentioned, which is great, but I think there's some other SDGs that you'll be doing by making the connection between early child development and the broader environment. And I mentioned 3 which are proximal and linked to air pollution, which is the cities. There's one SDG, is 11.6, which is on clean air in cities. There's access to clean energy in the home, SDG 7.2. And there's deaths, a reduction in deaths due to air pollution indoors and outdoors is SDG 3.6, which is not health. There's also the climate one, but the climate is less quantitative, but they will be connected. So why is important the SDGs? Is not only because they exist, because this is the tracking mechanism. You have to be able to tell the story. You have to be able to have some indicators and to show what you've done. and to be able to reflect on what you're doing and learn the lessons. So having hard indicators is part and parcel of the transformation. It creates accountability, it creates ownership, and also is a way of engaging with different groups. You have your statistical department, you have universities, you have people who are collecting knowledge on these sectors. These are all disconnected. If you can make something for your city, for example, that makes use of the data that these different sectors are using, there's a way of them owning the actions and the results that you're about to produce. And I think this is my last slide. It is. So I thank you for the opportunity, and I look forward to the next 2.5 days or 3 days. I will learn a lot, I'm sure, but I'm excited with the fact that you are engaging in an action plan, or there's some decisions coming out of this group. I look forward to contributing and to learning from what you do and to implementing my next work. I'm working with some countries around schools and things, and I'm really eager to engage with you all. Thank you for the opportunity. Pleasure to be with you.